Hi, this is Ron French from the Shoulder and Hand Therapy Center in Paris, Tennessee. I'm an occupational therapist and a certified hand therapist. Today I'm here to talk to you about tennis elbow, or as we call it in the therapy field, lateral epicondylitis. When you get it, the first symptoms you're going to get is some pain right here on the side of your elbow, running down, maybe go all the way down into your forearm. The very first thing to do for when it starts hurting is to figure out what you're doing that causes the pain. It's not always tennis, you know. Any kind of repetitive wrist motion where you're pulling back, especially if you're doing it with some force, can cause this problem. So that's the first thing to tackle, and maybe it'll go away on its own. If not, usually with my patients, the first thing that I'll recommend is some type of elbow brace. Now, you've probably seen people with these before. These go on your forearm right across here. Now, where we're going to put this is on that muscle that extends that wrist that is inflamed. And that muscle is called the extensor carpi radialis brevis. But basically, it runs right along here and pulls that wrist back. It gets very sore. These braces here, what you want to do, the ones I prefer have a pad on them. Now, they're not just a strap. There's a little pad of some type, a gel pad. This particular one has a little pad you can pull out. Sometimes I like to give these to patients and recommend they put these in the freezer, get them cold, slip them back in there. Because ice is kind of the thing you want to use with this. That pad goes right on top of that little tender muscle that you have. And then just a little bit of tension on that, and then strap it down. And you want to put just a hair of tension. And what that does is it stops that muscle from being able to fully contract when you use it. And it stops the pull down here so much where it's sore. It gives it time to heal. This is a fairly, you don't have to go to the doctor to get one of these. You can go to the drugstore and buy them. You can buy them online. They're all over the place. Also, we'll talk to patients. I always like to tell them to contact their doctor and talk to them about some kind of inflammatory drug, because this is an inflammation, and if the patient can take an anti-inflammatory, it usually helps with this type of problem. But they should always run that through the doc first. There's various ways to work with it. One thing you'd like to do is to increase the blood flow through there. So heat will do that, but you have inflammation in there, and heat might not be the best thing to put on there. A lot of therapists these days are doing what we call scraping, and you can buy a fancy tool, but you really don't need one. You can get a spoon, or this is a little gadget I use to measure finger joint, how far they can bend. And you really just want to start scraping across that muscle, downward motion, just like this. And that will start to increase the blood flow. And you'll know, because after about a minute or so, it'll start to turn red. And after it turns red, well, you're done. And you've increased the blood flow, and that's going to help it heal quite a bit. Another thing that most of us have been doing for years are cross-friction massages. So you have to imagine the muscle's fibers are running this way. And you really want to get on it and massage it the opposite way. And you got to do it fairly deeply. Now, when you do cross-friction massages, you'll feel a little pain, but it should slowly go away and definitely not get any worse as you go. Mild pain is fine. If it starts getting worse, or it's past a mile, past that, say, 3 mark or out of 10, you should stop doing it, because you're not quite ready for that yet. So be careful with that. The other thing I want to talk to you about is icing. And I mentioned before that we like to ice these little gadgets. Those gel packs, if you buy one with a gel pack, you can also ice those. And that's one way to ice. And another way that I really like to ice is to do an ice massage. And what I do is I keep these little cups in the freezer in the back. And when I want to do an ice massage on a patient, I just kind of tear it corner off, and I've got ice there, and then it's something tolerable I can hold on to while I take it and massage this area. And just like any cold, it'll start to sting at first, First it's cold, then it stings, and then it slowly goes numb. And that's really good for that this type of problem. Okay, I think I've hit everything I need to tell you about it. There's many ways to go about treating this. What I've talked to you about is what's been most effective for me and my patients during my career. So you have a great day, and this is Ron French signing off from Paris, Tennessee.